We isolate the T cells or the TCRs from patients who have responded to immunotherapy and then identify what is the TCR recognizing on this huge diversity of the platform. We received very positive FDA feedback on the pre-IND meeting end of last year, so a little Christmas gift. We need to get back to fund innovation and not only projects. Also, innovation has a risk in itself, and if you want to innovate, you need to accept that.
Onyx Live is proudly sponsored by Humphrey's Law.
Thank you so much for joining us, really appreciate it. Could you start by introducing yourself to our readers, please?
Yeah, thank you for having me. My name is Stefan Scherer. I'm the CEO of 3T Biosciences since about 4.5 years. Spent most of my career actually in big pharma. I was in Roche, Genentech, Novartis, GSK. Spent also time at Selectis as a CMO with an allogenic CAR-T company, which is a little bit more an advanced biotech. And by training, I'm MD, PhD, and was trained in medical oncology, mainly on the GI part.
Fantastic. Okay, so could you explain in a bit more depth what are 3T Biosciences working on and how is it benefiting patients?
Yeah, 3T Biosciences basically started about 7 years ago, so it's a spin-out from Stanford. We licensed a platform from Chris Garcia's lab, which is focused on recognizing of peptide-HLA targets. So what we're doing, we have a platform which has 1 billion peptides per HLA, spanning over 30 HLAs. So essentially we cover basically the entire population with a few exceptions at the end of the day. So what we do, we isolate the T cells or the TCRs from patients who have responded to immunotherapy and then identify what is the TCR recognizing on this huge diversity of the platform. And then we turn basically this into a kind of an antibody format, a TCR bispecific or a TCR mimetic. And that enables us basically to treat patients which are originally unresponsive to immunotherapy. Our lead target actually goes in an indication which is hugely unserved, MSS colorectal cancer, microsatellite stable colorectal cancer, which is about 80 to 90% of the colorectal cancer patients. And that is basically up to now is unresponsive to PD-1, PD-L1 therapy. And so we have now the option with this molecule basically to hook one part of the antibody on the tumor and the other part will recognize and will attract the T cell so that we can really treat cancer patients who are unresponsive to immunotherapy with an immunotherapy treatment.
And so what progress have you made so far in your pursuit of getting into the clinic?
Yeah, we started basically with identifying the target, which is actually with the platform enables us to do this in about a year, so it's very fast. So in terms of productivity, the platform is really offering us and also our collaborators a lot of productivity gain in identifying targets and turning that actually in a DC candidate. So we are now in the IND-enabling. We received very positive FDA feedback on the pre-IND meeting end of last year, so a little Christmas gift. And we are finalizing now the IND preparation, filing for the IND probably in February or March, and plan to treat the first patient in April or May.
So where would you say the greatest value lies? Is it the targets that you're identifying, the data, or the wider platform itself?
We're using basically a two-pronged approach. So one is, of course, basically the huge diversity of the platform, but we're not isolating the targets by just looking what is on top of the tumor cells. We're isolating targets with a functional background, so to say. We want to know, is the target actually doing something in cancer or not? That's why we're using patients' samples who have responded to immunotherapy. And our lead target, for example, the TCR has a clonality of around 3%, which is very high. And that kind of enables us really to do a functional read on the targets and not only checking what is on the surface of cells or tumor cells. You can do it with mass spectrometry, and there's nothing wrong with that at all, but that doesn't give you necessarily a functional readout. And with that perspective, we are, first of all, faster in the identification, and second, we believe we are closer to having really a target which works in patients.
Now, I understand that you recently appointed a new CMO?
Yes, we did. Asad Karabi is our new CMO. He has a lot of experience in the field. He was at Kite Gilead, T-Knife. He's also an MD by background, of course, and he worked with us as a consultant from August last year to the end of 25 and joined now full-time as of January 1st.
So what milestones can we look forward to over the next 12 to 24 months?
So for us, basically, the next thing is really kind of, and this is a big step because it's a transformation of the company. So we transformed the company from a preclinical or research biotech, if you want, to a clinical stage biotech. And that's something which doesn't happen too often. And I'm really proud of the team, what it has achieved in the last 3 years, so to say, to turn that target around. So we hope to treat the first patient in Q2, and so that would be the first milestone, and having some early readouts by the end of the year.
Amazing. And what is your message to investors this week?
Well, I mean, to investors, basically, I think we need to get back to fund innovation and not only projects. So the de-risking basically needs to come to a point that we accept also innovation has a risk in itself. And if you want to innovate, you need to accept that. If I only want to deploy project money in terms of I have a very de-risked asset and want to basically finalize the last steps in terms of getting into the clinic, that's a different way of innovation and funding. So I think it has to shift that innovation, which has an inherited risk, is appreciated as well by investors again.
What do you think the general sentiment is at JPM this year?
I think the mood is quite good, right? I mean, there is a lot of happening in the public markets. There's a lot of happening in M&As, especially there. Big M&As, with billions of dollars, as you all know. A few may be coming out this week as well, so the rumors are here, so we will see. And but I hope that the pendulum is shifting back. And for the conversations we have, it actually looks like it will. Yeah.
Exciting times, Stefan. Thank you so much.
Thank you.
Appreciate it.
Thank you.